Missoula's Partnership Health Center is one of 1,400 community health centers across the country that went off a funding cliff at the end of September. Congress didn't reauthorize a program that has received bipartisan support for nearly 50 years.
Partnership served more than 15,000 patients last year. MTN's Augusta McDonald is on special assignment tonight and has the story on what could happen if Congress doesn't act and what the hospital is doing to keep meeting the needs of their patients in a rapidly evolving healthcare landscape.
Community health centers have a long legacy of serving people with limited access to health care.
It started in the 60s during the War on Poverty. There are now almost 1,400 nationwide. We're one of those, and we're one of 17 in the state of Montana.
Montana Primary Care Association reports that health centers have been growing in our state for the past 4 years. In 2016, they served 10% of the state's population. That's over 100,000 people. 85% of their patients are low income, but they're able to get services because of the unique way these centers operate.
Health centers were set up to serve people who have a tough time affording care and have difficult lives in this country. Typically, they're people with minimal income, sometimes with lower educational level, often unemployed or underemployed.
The current healthcare landscape is tough on community health centers. They have multiple funding streams that are being threatened. Let me break them down for you. From funding to support the doctors that work here, to insurance to reimburse the hospital for the work that it does, to direct federal money that makes up a big chunk of their budget. Healthcare cuts on all of these levels could affect the care that these patients receive. These are patients who might not otherwise get it. The most concerning is Congress's failure to reauthorize 70% of their funding at the end of September. The director of Partnership told me that would be about 10% of their total budget. They're big enough to be able to maintain their services, but they're looking at ways to save money and likely limit expansions that they would have made. Statewide, this picture is not so resilient.
You know, when we run through the numbers for the whole state of Montana, upwards of 27,000 Montanans could lose access to services, not because it's Partnership. I mean, Partnership is big enough and has enough patients from other sources that they can make adjustments, but other smaller health centers, they don't have that luxury. I mean, they're operating with 500 patients a year, not 15,000 patients a year. And that's where the Community Health Center Fund has been so instrumental in getting healthcare to rural Montana.
Another fund expired that provides medical professionals to deliver this care. The National Health Service Corps pays recent medical school graduates student loans so they can take a pay cut to work in rural areas like Montana.
Yeah, work with people in need, and that's kind of really where my passion's at. So, so the National Health Service Corps essentially helps me to afford to be able to do something like that.
Close to a dozen doctors and dentists work at Partnership because of this program. The thing about health centers is they serve everyone, and they're required to provide a wide range of services. When patients don't have insurance, are on Medicaid, or cannot pay full price, this federal funding makes up the difference.
Then there's also cuts embedded in the Medicaid program that will directly impact community health centers, because people forget that we're a business, so not all of our funding comes from the community health center program. It really depends upon how big or small or how rural or urban you are. We actually do a ton of third-party billing.
Congress's recent failure to reauthorize the Child Health Insurance Program, or CHIP, was just another hit that health centers will have to absorb if they cannot pass the bill currently headed to the Senate.
Kids who are on CHIP have lower income. They come from families with fewer means. Some of them have actually pretty significant health problems, and they rely on coverage to be able to get the health care they need. So I was thinking of like a 6-year-old who has asthma, and their family has to decide between housing, food, medications, and how does a family make a decision like that?
CHIP supports health care for over 23,000 kids in Montana, and that remains in jeopardy. A bill passed in the House last Friday that extends funding for community health centers, the programs that support their doctors, and CHIP insurance funding. That bill, called the Champion Act, is now being sent to the Senate for consideration. However, because of the funding offsets that are written into the bill, health center advocates are telling me that they don't expect it to get the bipartisan support that it needs to pass. Reporting in Missoula, I'm Augusta McDonald for MTN News.
We have an extended version of this report online, and of course we'll continue to follow ongoing local, state, and federal decisions that affect health care.